Hello everybody, my name is Dr. Aheed Khan and I work as a pediatrician in New Delhi. If we have to talk about what are the new symptoms of COVID and especially on the viewpoint of children, there are a few symptoms which are new. Actually, these symptoms are typically coronavirus symptoms. For example, diarrhea, fever, cough, body ache, headache. But the difference between this year and the last year was last year most of the patients, especially children that we were seeing, were asymptomatic. And now most of the children that we are admitting with, even with fever for one day or just diarrhea and nothing else, are coming out to be COVID positive. Children are coming with just rapid breathing and nothing else, no fever, and it could be some allergies, starting of asthma, but most of these patients are now coming out to be COVID positive. It could be because of the new variants, of course, it could be because of that, but it could also be because of some idiopathic resistance of the virus to the immune responses. And we really don't know at this point why is this virus coming out to be in children, and which is a kind of concern, because when we talk about vaccination, which has been approved for everybody above the age of 18, I don't see any point in not giving the same vaccination to kids, because most of the vaccines that we have developed, they are first tested in adults and then they are tested in the kids. And now after this vaccination drive would be over, a lot of kids would have the virus and they would be spreading the virus even either asymptomatically or symptomatically. So I hope that the government goes on and start vaccinating kids as soon as possible. So there were a lot of posts on how to take care of patients who are there at home. For kids, we usually do not prescribe a lot of medication because they are not able to take a lot of medications at home. We usually give paracetamol for fever, or we give some multivitamin, and we advise giving them citrus fruits which have all higher sources of vitamin E or vitamin C. And we don't really rely on the medications, because most of the time when you give a lot of medications to kids, they don't really take it, and it creates a lot of other complications like nausea and vomiting. I think that's all for this thing, and I hope if you can have any questions or any query related to pediatrics or related to the adult COVID, please do go ahead and ask me, and I'll reply whenever I could.